So today I'm going to be talking about the Talar tilt test. Sorry about the terrible camera angle. This is really the only way we can film it. And so for the Talar tilt test, it typically tests for an ankle sprain. And so there are two different versions of it. There's the inversion and the eversion of it. So for the inversion, well, for both of them, in order your action is you're going to have one hand to stabilize right above the ankle and another hand that's going to grab the calcaneus and talus. You're going to be palpating the calcaneofibular ligament, also known as the CFL, and then also the deltoid ligament, which is on the medial side. And so for the inversion test, you're going to invert the foot. And so it's going to be a passive movement, and the patient is going to be keeping their leg and foot neutral as you are inverting it. And so this is testing for a ligament sprain of the calcaneofibular ligament, and it could also another thing that it could also be sprained would be in the anterior talofibular ligament and the posterior talofibular ligament. And a positive indication of this would be pain or a talus tilt or gap. And so the sensitivity of this test is 0.96 and the specificity is 0.68. For the eversion, you're going to have the same positioning where you're going to have them maintain a neutral position. You're going to have one hand stabilizing and another hand on the calcaneus and talus with one side palpating the CFL and another side palpating the deltoid. So instead of inverting it though, you're going to be everting it. And so when you're doing this, if you can see, so when you're doing this, you're going to see if there's any pain or talus tilt or gapping, and this is testing for the deltoid ligament and seeing if there's a sprain there. According to Rosen and Brown, it has a sensitivity of 0.49 and a specificity range of 0.72 to 0.8. So here I just wanted to show a closer up picture of how the test is actually performed, because I know I kind of gave only one camera angle that's farther away. So just here you can see a close-up of what's actually happening and what the movement actually looks like. And another thing I want to note is that for the inversion tilt, the one that you're seeing right now, the modification of it is performing the test in different positions of the range of motion of the ankle, just so you can stress different parts of the lateral joint capsule so you can see that if there is a ligament sprain in any way. From what I could find, there weren't any modifications of the eversion tilt, but it does seem to me that you could do it in different range of motions, like the inversion tilt as well.